I'm about to reveal the 3 specific vitamins that are scientifically proven to restore blood flow to your legs, reduce swelling, and stop that heavy, tired feeling that makes walking difficult. While medication can manage symptoms, these nutrients actually repair the structural damage in your arteries and veins that causes poor circulation in the first place. But here is the problem: most seniors are taking the wrong forms of these vitamins or relying on supplements that their bodies simply cannot absorb due to age-related digestive changes. I'm going to show you exactly how to get these powerful compounds from specific food sources that act faster and safer than pills. I am Dr. James Williams, and I am 35 years old. In my years of treating older adults for vascular health issues, I have seen patients regain the ability to walk without pain simply by correcting specific nutritional deficiencies that were weakening their blood vessels. I have worked with hundreds of seniors who were told their cold feet and leg cramps were just part of aging, only to find that their arteries were starving for the right building blocks. When your legs feel heavy, swollen, or cold, it is often because the microscopic valves in your veins are failing or the arterial walls have become stiff and brittle. You might notice that your socks leave deep indentations in your ankles at the end of the day, or that the skin on your shins looks shiny and tight. These are not just cosmetic issues. They are warning signs that your peripheral circulation is struggling to fight gravity and push blood back to your heart. Unfortunately, many doctors might overlook these early dietary signs, prescribing water pills or painkillers that mask the signal instead of fixing the fuel gauge. We need to address the root cause, which is often a lack of the specific nutrients that keep your vascular system elastic and strong. 1. Red bell peppers. Your first step to rebuilding your leg circulation is to eat half of a red bell pepper every single day, preferably raw or very lightly sautéed, before you consume any other carbohydrates. This simple vegetable is one of the most potent tools we have for vascular repair because it is significantly higher in vitamin C than oranges, yet it comes without the high sugar content that can damage blood vessels in seniors with insulin resistance. Vitamin C is not just for immunity. It is the absolute requirement for your body to manufacture collagen, which is the structural protein that makes up the walls of your veins and arteries. Without adequate collagen, your blood vessels become like old, dried-out rubber hoses. They crack, leak fluid into the surrounding tissues, and lose the elasticity needed to pump blood effectively. When you supply your body with the high-quality bioavailable vitamin C found in red bell peppers, you are essentially giving your system the raw materials to patch up these microscopic leaks in your lower, gravity-dependent vessels. I want you to understand that the swelling in your ankles often occurs because the vessel walls are too permeable, allowing water to escape into the tissue rather than staying in the bloodstream where it belongs. Strengthening these walls is the first defense against edema. A calm, consistent intake of this vegetable reinforces the endothelial lining, which is the smooth inner layer of your blood vessels, ensuring that blood glides through smoothly rather than snagging on rough patches that can lead to clots. I recall a patient named Martha who was 72 years old and came to me complaining of constant, mysterious bruising on her calves and a feeling of heaviness that made her avoid the stairs. She was taking a generic multivitamin, but her diet was very low in fresh vegetables, and she relied heavily on toast and tea. Martha made the mistake of thinking that because she didn't have scurvy, her vitamin C levels were fine, but her blood vessels told a different story. They were fragile and breaking under the slightest pressure. We didn't overhaul her entire life. We just added sliced red bell peppers to her lunch every day. Within 4 weeks, the spontaneous bruising stopped completely, and she reported that her legs felt lighter because the fluid retention had significantly decreased. This simple addition supports steadier readings in your lower body blood pressure and reduces the capillary fragility that leads to spider veins. 2. Sunflower seeds. The next essential item for your circulation toolkit is a 1/4 cup of raw, unsalted sunflower seeds, which you should view as a natural way to manage blood viscosity. These seeds are arguably the best natural source of vitamin E, a nutrient that plays a critical role in preventing your red blood cells from clumping together, specifically in the narrow, twisting veins of the lower legs. As we age, our blood can naturally become slightly thicker and more prone to aggregation, especially if we are dehydrated or inactive. Vitamin E acts as a mild, natural blood thinner, not in a dangerous way like a pharmaceutical, but by altering the electrical charge of blood cells so they repel each other slightly, sliding past one another like oil rather than sticking like mud. This improvement in flow dynamics is essential for seniors because the blood in your legs has to fight gravity to get back up to your heart. If that blood is thick and sticky, it moves sluggishly, pooling in the calf muscles and increasing the pressure on your delicate venous valves. By ensuring you have adequate vitamin E, you are effectively greasing the tracks. This reduces the workload on your heart and lowers the risk of developing a thrombus or clot in the deep veins of the leg. Furthermore, vitamin E is a potent antioxidant that protects the fats in your blood from oxidizing. Oxidized cholesterol is what sticks to artery walls and forms plaque, narrowing the passage for blood flow. Let me tell you about Robert, a 68-year-old retired teacher who loved to garden but found that after just 20 minutes of kneeling or standing, his calves would throb with a dull, aching pain. He was drinking plenty of water, but his circulation was still sluggish, and his doctor was monitoring him for potential clotting issues. Robert's mistake was fearing all fats, so he had cut out nuts and seeds entirely, leaving him deficient in vitamin E. We introduced a small handful of sunflower seeds to his morning oatmeal routine. It wasn't an overnight miracle, but after 2 months, Robert noticed he could work in the garden for an hour before needing a break. The throbbing sensation diminished because his blood was moving more efficiently through those microvessels in his calves. It is important to understand that surface-level explanation of how this works. Your blood vessels are lined with cells that release signals to relax or constrict. Vitamin E helps preserve the function of these cells, preventing them from becoming stiff. A study published recently highlighted that older adults with higher plasma levels of vitamin E showed significantly less arterial stiffness than those with lower levels. This stiffness is a major contributor to high blood pressure and poor distal circulation. By keeping the blood fluid and the vessel walls pliable, you are attacking the problem from 2 angles simultaneously. To implement this, simply sprinkle 2 tablespoons of sunflower seeds over your salad, yogurt, or porridge once a day. It is vital that you choose unsalted seeds, as excess sodium is the enemy of circulation. It draws water into the blood, increasing pressure and worsening swelling, which is the exact opposite of what we are trying to achieve. You also want to ensure they are raw or dry roasted without added unhealthy vegetable oils. The natural oils in the sunflower seed itself are what contain the vitamin E, so we want to preserve those in their original state. A brief caution is necessary here. Because vitamin E does have a mild blood-thinning effect, if you are currently taking prescription blood thinners like warfarin or Eliquis, you must consult your doctor before adding large amounts of vitamin E-rich foods to your diet. Usually, dietary amounts are safe, but it is always responsible to check. For most, this is a safe, nutritional way to support healthy blood flow. This habit supports smoother blood flow through the smallest capillaries in your toes and feet. 3. The ankle press and capillary check. We are going to pause the dietary list for a moment to establish a critical daily measurement habit called the ankle press. Every morning before you get out of bed or immediately after your shower, I want you to firmly press your thumb into the soft tissue on the inside of your ankle, just above the bone, and hold it there for a slow count of 15 seconds. This is not an exercise. It is a diagnostic check that tells you exactly how your lymphatic and venous systems are handling their load. You are checking for pitting edema. If your thumb leaves a dent that stays there for more than a few seconds, it means fluid is leaking out of your vessels faster than it can be cleared. Seniors need a daily way to gauge if fluid is accumulating before it becomes painful or visible to the naked eye. By the time you see gross swelling or feel that your shoes are tight, the problem has already advanced significantly. This test gives you a leading indicator. If you wake up and the skin bounces back instantly, your circulation was efficient overnight. If you leave a deep pit, it means your valves struggled, or perhaps you consumed too much salt the day before. This feedback loop is essential because it allows you to adjust your behavior. Maybe you need to elevate your legs more that day or drink more water before the swelling becomes a chronic issue that damages the skin. I remember Eleanor, a 75-year-old patient who dismissed her cankles as just a cosmetic annoyance she had to live with. Her doctor rarely checked her feet during their quick consultations, so the gradual increase in fluid went unnoticed until she developed a small ulcer that wouldn't heal. Her mistake was ignoring the signal her body was sending every day. We taught her the ankle press, and she realized that on days she ate processed soup, the pit was deep. On days she walked more, it was shallow. This simple tactile feedback gave her control. She learned to predict her bad leg days and take preemptive action, eventually reducing her baseline swelling by half simply by reacting to the data her own thumb provided. The explanation for this is grounded in the physics of your body. Your circulatory system is a closed loop, but under pressure, the liquid part of the blood, plasma, gets pushed out through the capillary walls into the spaces between cells. In a healthy young person, the lymphatic system vacuums this up immediately. In seniors, this vacuum is weaker. When you press your thumb, you are displacing that interstitial fluid. The time it takes to refill tells us about the pressure in the tissue. If it refills instantly, the tissue is hydrated but not waterlogged. If it stays indented, the tissue is swamped, which compresses the capillaries and prevents fresh, oxygenated blood from reaching your skin, leading to ulcers and hair loss on the legs. To do this correctly, sit on the edge of your bed. Cross one leg over the other so you can reach your ankle easily. Use the pad of your thumb, not the nail. Press firmly enough to turn the skin white, blanching, and count slowly. Release and look immediately. Run your finger over the spot. Can you feel a dip? Doing this at the same time every day provides a consistent baseline. If you notice the indentation getting deeper over a period of weeks, that is valuable information to bring to your doctor, far more useful than a vague complaint of heavy legs. A caution: do not press so hard that you cause pain or bruising. The goal is to displace fluid, not damage tissue. If the area is red, hot, or tender to the touch, do not press it. That could be a sign of infection or a clot, and you should seek medical attention immediately. This simple check supports proactive management of your leg volume and vascular health. 4. Lean chicken and tuna. The third vital nutrient for your leg circulation is vitamin B3, also known as niacin, which you should source primarily from lean chicken breast or tuna. This is not just about protein, it is about vasodilation, which is the medical term for the widening of your blood vessels. Niacin is unique among vitamins because it directly affects the smooth muscle cells that line your arteries, signaling them to relax and open up. When these vessels relax, the channel becomes wider, allowing more blood to flow through to your extremities with less resistance. This is particularly crucial for seniors who suffer from cold feet or toes, as these are signs that the tiny capillaries at the end of the line are clamped shut. Many seniors struggle with what is called peripheral vasoconstriction, where the blood vessels in the limbs clamp down to preserve heat for the core organs. While this is a survival mechanism, in modern life, it just means your legs are constantly starved of oxygen. By including rich sources of B3 like chicken and tuna in your diet, you provide the chemical trigger your body needs to reverse this clamping. It's like turning the handle on a faucet. The pressure remains the same, but the volume of flow increases because the pipe is wider. This helps flush out metabolic waste products that accumulate in the leg muscles and cause cramping and soreness. Consider David, a 70-year-old gentleman who complained that his feet were blocks of ice, even in the summer. He wore 2 pairs of socks to bed and still felt the chill. David's diet was heavy on pasta and bread, but very low in high-quality protein. He was effectively running on empty regarding niacin. We adjusted his dinner routine to include a serving of grilled chicken breast or a tuna salad 3 times a week. He didn't experience the uncomfortable flush that comes from high-dose niacin supplements. Instead, he experienced a gradual, gentle warming. Over 3 months, the color returned to his toes, turning from a pale, waxy white to a healthy pink, indicating that blood was finally reaching the periphery. The reason we focus on food sources rather than pills for niacin is that supplements can cause an intense, uncomfortable flushing reaction and can even stress the liver in older adults. Food sources like tuna and chicken release the B3 slowly during digestion, providing a sustained, steady signal for vasodilation without the shock to the system. Additionally, these foods provide the amino acids necessary to maintain the muscle mass in your calves. Your calf muscles act as the pump for your veins. If they waste away, your circulation suffers. So, you're getting a double benefit: fuel for the pump and a signal to open the pipes. This dietary change supports the relaxation of arterial walls and improves warmth in the lower extremities. 5. Seated heel raises. You must incorporate a specific physical movement known as the seated heel raise into your daily routine, preferably performing it for 2 minutes every hour you spend sitting. This is the single most effective same-day lever you can pull to mechanically force blood out of your lower legs and back up to your heart. While vitamins repair the vessel walls, they cannot fight gravity on their own. They need a pump. Your heart pumps blood down to your feet effortlessly, but the return trip requires the assistance of your calf muscles, which are often referred to by doctors as the second heart. When these muscles are inactive, blood pools, creating the stagnant environment that leads to swelling and clots. It is crucial to understand that the veins in your legs rely on muscular contraction to squeeze the blood upward through a series of one-way valves. If you are sitting and watching television or reading for hours, your second heart is asleep. The blood sits there, causing the veins to stretch and the valves to leak. This simple movement wakes up the pump without stressing your joints or requiring balance, making it perfect for seniors with limited mobility. By contracting the calf muscle, you manually compress the deep veins, shooting the blood upward and relieving the pressure that causes heaviness. I treated a patient named Thomas, aged 78, who spent most of his day in a recliner due to arthritis in his knees. His ankles were permanently swollen, not because of heart failure, but because of gravity-dependent edema. Thomas believed he needed to rest his legs to reduce the swelling, which was actually the exact mistake making it worse. We instructed him to do heel raises during every commercial break on TV. Within 3 days, the visible fluid retention in his ankles decreased by nearly half. He was amazed that such a small movement could do what high doses of diuretics had failed to achieve. The physiological explanation is mechanical rather than chemical. Your deep leg veins run directly through the soleus and gastrocnemius muscles. When you lift your heels, these muscles bulge and flatten the veins against the bone, acting like a hand squeezing a tube of toothpaste. This action clears the backlog of old deoxygenated blood and allows fresh, nutrient-rich blood carrying the vitamin C and niacin you've eaten to enter the tissue. Without this mechanical clearing, the nutrients you eat essentially get stuck in traffic and cannot reach the cells that need them most. To perform this correctly, sit in a sturdy chair with your feet flat on the floor and your knees bent at a 90-degree angle. Keep your toes on the ground and lift your heels as high as possible, feeling a strong squeeze in the back of your calves. Hold the top position for 2 seconds. This pause is critical. Then lower your heels slowly. Do not bounce. Aim for 20 repetitions at a time. You can even place a heavy book on your knees to add resistance as you get stronger. A caution for those with a history of Achilles tendinitis. Start gently and do not force the range of motion if you feel sharp pain in the back of your heel. The movement should be felt in the muscle belly, not the tendon. This mechanical action supports the immediate reduction of venous pressure in the lower limbs. 6. Spinach and arugula salad. To specifically target arterial flexibility, you should consume a mixture of spinach and arugula, rocket, at least once a day, ideally as a side salad with dinner. These dark leafy greens are the premier dietary sources of dietary nitrates, which your body converts into nitric oxide, a short-lived gas molecule that signals your blood vessels to relax and widen. While vitamin C builds the structure and niacin opens the door, nitric oxide is the constant chemical signal that keeps the vessel from snapping shut. As we age, our natural ability to produce nitric oxide declines by up to 50%, which is a primary reason why blood pressure rises and circulation slows down in our later years. The synergy here is fascinating. The vitamin C from the bell peppers we discussed earlier actually helps preserve the nitric oxide generated from these greens, preventing it from breaking down too quickly. This creates a powerful environment for vascular health. When you eat arugula, the nitrates interact with bacteria in your mouth, which is why chewing is important, and are then converted in the stomach. Once in the bloodstream, they dissolve the stiffness in the arterial wall. A recent study specifically focusing on senior vascular health demonstrated that older adults who consumed just 1 cup of nitrate-rich greens daily had significantly lower arterial stiffness scores compared to those who did not, directly correlating to better walking distances. Let me share the case of Margaret, a 66-year-old who suffered from intermittent claudication, a cramping pain in her calves when she walked more than a block. Her arteries were stiff, unable to dilate enough to supply the extra oxygen her muscles needed during movement. Margaret's mistake was relying on iceberg lettuce, thinking, a salad is a salad. Iceberg lettuce has almost zero nutritional value for circulation. We switched her to a mix of peppery arugula and spinach. It took about 6 weeks of daily consumption, but she gradually noticed she could walk to the mailbox and back without stopping. The pain threshold had moved because her vessels were finally able to dilate on demand. The science is clear. Nitric oxide is a vasodilator. Imagine a narrow road that suddenly expands into a 4-lane highway. Traffic flows faster and with less congestion. That is exactly what happens in your legs. By relaxing the smooth muscle tone of the arteries, you lower the resistance against which your heart has to pump. This not only helps your legs feel warmer and lighter, but also reduces the systemic workload on your cardiovascular system. It is a natural, gentle way to manage blood pressure without the abrupt drops that medication can sometimes cause. The best way to eat this is raw or very lightly wilted. Heat can degrade nitrates, and boiling spinach pours the nutrients down the drain. Make a simple salad with olive oil and lemon juice. The acidity of the lemon helps with the conversion of nitrates and aids iron absorption. Avoid using antibacterial mouthwash immediately before or after eating these greens, as it kills the good bacteria on your tongue needed to start the chemical conversion process of the nitrates. This dietary addition supports the natural elasticity and responsiveness of your leg arteries. 7. Timed water intake. We must address a long-term lever that is often ignored. A strict strategy of timed water intake, specifically drinking a full glass of water immediately upon waking and another 30 minutes before each meal. Hydration is the most overlooked factor in senior circulation issues. You can have the strongest vessels and the best pump, but if the fluid inside the system, your blood, is the consistency of sludge, it will not flow. As we age, our thirst mechanism blunted. We simply do not feel thirsty until we are already significantly dehydrated. This chronic low-level dehydration reduces total blood volume and increases viscosity, making it physically difficult for blood to travel through the tiny capillaries in your toes. Water is the medium in which all these vitamins and nutrients travel. If you are dehydrated, the plasma volume drops, and the concentration of red blood cells increases, hematocrit, making the blood thicker. Thick blood is prone to clotting and moves sluggishly. By implementing a timed schedule, you bypass the unreliable thirst signal and ensure your blood viscosity remains optimal. This is especially important in the morning because you lose a significant amount of water through breathing while you sleep. Waking up and moving immediately with thick blood puts immense strain on your circulation. I recall James, a 71-year-old who came to me with cold hands and feet and a diagnosis of poor circulation. He was spending a fortune on supplements but drank only coffee and tea until dinner time. James made the common mistake of thinking that any fluid counts as hydration, ignoring the diuretic effect of caffeine. We didn't change his diet initially. We just prescribed 2 glasses of water at specific times, 7 a.m. and 11:30 a.m. The change was rapid. Within a week, he reported that his extremities felt warmer. By simply increasing the fluid volume, we improved the pressure needed to push blood to the furthest points of his body. This hydration habit supports optimal blood viscosity and transport of nutrients. 8. Avocado. The final item on our list, acts as an absorption booster and is critical for the efficacy of vitamin E. Eat 1/4 to 1/2 of an avocado daily. We discussed sunflower seeds earlier as a source of vitamin E, but here is the catch. Vitamin E is fat-soluble. This means your body simply cannot absorb it effectively unless it is consumed alongside dietary fat. Many seniors, in an effort to be heart healthy, have removed too much fat from their diets, resulting in secondary deficiencies. They are eating the vitamins, but excreting them unused. Avocado provides the perfect, healthy, monounsaturated fat vehicle to ensure the vitamin E enters your bloodstream. Beyond acting as a carrier, avocados are themselves rich in potassium, containing more than bananas. Potassium is the mineral counterpart to sodium. While sodium draws water into the blood and raises pressure, potassium pumps it out of the cells and lowers pressure. This balance is vital for reducing the swelling in the lower legs. An avocado gives you a dual benefit: the fat to absorb the blood-thinning vitamin E, and the potassium to flush out the excess fluid causing the edema. It is a complete package for vascular support. I had a patient named Susan, 69, who was very strict about her weight and ate a low-fat diet consisting mostly of steamed vegetables and crackers. Despite her clean eating, her skin was dry and her circulation was poor. She was taking vitamin E supplements, but her blood levels remained low. Susan's mistake was nutritional isolation. She didn't understand nutrient pairing. We added avocado to her lunch toast. Not only did her vitamin E levels normalize in her neck's blood panel, but the quality of the skin on her legs improved. It became more elastic and less prone to the shiny, tight look associated with swelling. A caution: avocados are calorie-dense. You do not need to eat a whole one every day. 1/4 to 1/2 is sufficient to get the absorption benefits without unwanted weight gain. If you are watching your calorie intake strictly, substitute this for other fats, like butter or oil, rather than just adding it on top. This food choice supports the maximum absorption of vascular protecting vitamins and fluid balance. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.